My name is Dr. Eva Cheung. I'm a pediatric cardiologist and an intensive care doctor at the New York Presbyterian Morgan Stanley Children's Hospital. I'm sure many of you have questions about the multi-system inflammatory syndrome in children that's related to COVID-19. And hopefully today, I can give you a little bit more idea about what it is. What is the multi-system inflammatory syndrome in children? It's a collection of symptoms in children and teenagers that suggests that the body is experiencing some form of inflammation. We think it's related to COVID-19 infection because these patients have either had a prior contact with someone that's had the COVID-19 virus, or they themselves may have had the COVID-19 virus weeks ago, but may or may not have had symptoms because of it. We test for this virus by either looking for the virus itself or looking for what's called antibodies inside the blood. The thing to keep in mind about this inflammatory syndrome is that it's very rare in children. What are the symptoms of the multi-system inflammatory syndrome in children? Most important symptom to look out for really is fever. Fever is typically more than 1 day and can be kind of high, greater than 101. In addition to the fever, you can have symptoms of gastrointestinal symptoms like stomach pain, nausea, vomiting, or diarrhea. There can be a rash, and that rash can be on various parts of the body, like the face, arms, legs, trunk, or back. There can be redness of the eyes, called conjunctivitis. There can be lip redness or swelling. If your child is not eating or drinking very well, they can experience dehydration. They also might have cough or labored breathing or trouble breathing. They may be experiencing body aches on any parts of their bodies where their muscles feel sore. This syndrome might also even affect the heart, where the heart rate may be fast. Or they might have some swollen glands, particularly on either side of their necks. They may experience peeling of the skin in the fingers or the toes, or have symptoms of headache, tiredness, or being irritable. How do we treat this multi-system inflammatory syndrome in children? For the most part, the treatment we give children is what we call supportive treatment, where we treat their symptoms. If they're having a fever, we can give them medications to bring down their fever. If they're not eating or drinking very well, we can provide them hydration. And if the syndrome is affecting their heart, there are medicines that we can give to decrease their heart rate or make their blood pressure better. And in some cases in the hospital, there are medicines that we can give to decrease the inflammation in their body. The most important thing to know about this syndrome is that the majority of children are getting better and they are going home from the hospital. So what should I do if I have a child that has fevers and symptoms like the ones above that make you worried that they might have this multi-system inflammatory syndrome related to COVID-19? The most important thing you should do is call your pediatrician. Tell your pediatrician what the symptoms are and how long they've been going for, and you and your pediatrician can make a plan about whether your child needs to be seen and evaluated further for this syndrome. My name is Dr. Eva Cheung, and I hope you find this helpful. Please stay safe out there.